Takeaway kebabs will be allowed, but a candlelit sit-down dinner for two or even for one, indeed, is banned. It's the first time a targeted lockdown has been imposed as Bolton records the highest COVID-19 case rate in the country, 128 for every 100,000 people.
The rise in cases in Bolton is partly due to socialising by people in their 20s and 30s. We know this from contact tracing. And through our contact tracing system, we've identified a number of pubs at which the virus has spread significantly. We're therefore taking the following action in Bolton, starting immediately. We will restrict all hospitality to takeaways only, and we'll introduce a late night restriction of operating hours, which will mean all venues will be required to close from 10 p.m. to 5 a.m.
Not surprised, to be honest. I expected something like this to happen again with the way everything's going. I think people are too relaxed.
This generation, we like to be out, free will, enjoy life, maybe go clubbing or restaurants and stuff, do you know what I mean? Because it gets quite boring at home.
I go out, but I still think about my grandma. Like, I don't do anything too extreme to the point where I could put my grandma at risk.
It's not only the young people. I go to supermarkets and a lot don't wear masks. So it's not only the young, it's the old too, it's everybody.
And tonight the leader of Bolton Council told us it was unfair to tarnish young people, but he also hit out at the rule breakers.
There is sadly a cohort that have sadly not followed or not been prepared to follow the guidance and have sadly flaunted the rules and coincided with some premises not being on top of all of the rules within their premises as well. This has led to a spread.
It is hailed as an example of the system working, but it's clear now that it is not working in other parts of the country. The director of testing for NHS Test and Trace apologised today, tweeting that there is capacity at the testing sites, but the laboratories are the critical pinch point.
How soon do you think it will be before those issues can be resolved?
In the coming weeks, we're working on it incredibly hard. Sarah Jane Marsh is leading that. She's an absolutely exemplary leader and we're doing everything that we can.
Mr Hancock did not answer the point about the laboratories, but a letter sent by the Prime Minister to a university and seen by Channel 4 News goes some way to explaining the problem, with Boris Johnson asking for urgent help. He writes, "One of our most significant challenges in scaling up capacity is the qualified workforce needed." The testing site at London's O2 this afternoon stood almost idle, and the Department of Health and Social Care tonight admitted that testing capacity was being targeted at the areas that need it most, which raises the risk that infection rates might be rising elsewhere and not detected. The King's College team behind the COVID-19 app say their figures show there are now about 3,000 cases a day.
It is going to get worse in the next few weeks. That's generally the prediction. Now, whether all these cases, which are in younger people than they were earlier, transfer over to problems in the hospital, I think we have to wait and see. But most of the projections are that it will have some impact on it, even if it's not as bad as we saw in the spring.
The pressure to improve the testing is intense. Universities are about to go back. Schools have already returned. There are calls for airports to have their own tests. And winter is coming.
Well, our North of England correspondent Claire Fallon is in Bolton for us now. Claire.
Well, by my count, this is the fourth time the rules have changed in Bolton in less than a week. And there is a reason for that. It's because there has been such a rapid and big rise in the number of cases of COVID-19 in this area. But there is also a problem with it, because when I was here last week, when there had been another change to the rules, people were telling me then that they couldn't keep up. They didn't know what they were meant to do and what they weren't meant to do at that point in time. But the reality is that in the last 2 weeks, what the numbers have done here is fairly staggering. So 2 weeks ago, the rate was 15 people per 100,000 with COVID-19 testing positive, and now it's over 120 per 100,000, which makes Bolton by some way as having the highest rate in England. Now, we're told that the issue of late has been around pubs and young people, two common themes in many places, but here clearly to a greater extent. I mean, the leader of the local council here has said the issue is that there are some people who are behaving irresponsibly. And so pubs, bars and cafes, they're not being told to close, but you can't imagine that some will be able to stay open with this because they're only going to be able to do takeaway, and there's a nighttime curfew, so they're going to have to close at 10 p.m. And I suppose there is also the issue here that the numbers have been going up while there have already been restrictions in place. So if people haven't been sticking to those rules, will having more rules mean that they're more likely to stick to them? But I think clearly they did have to do something here.
Claire, thanks very much. Well, we had expected to talk to Dr Yvonne Doyle of Public Health England, but her appearance was cancelled by them. We have asked them for a reason, but they haven't responded. But earlier I did speak to Jeremy Hunt, the former Health Secretary who's now chair of the Commons Health Committee. And I began by asking him how concerned he was about the rising number of COVID cases nationally.
Well, we all have to be very concerned. This is a sort of tipping point because there are two directions we could go. We could go in the direction of Korea and Belgium when they had their spikes and they got them under control and life carried on as normal as it can be in these circumstances. Or you can go in the direction of France or Spain, where the spike has led to growing levels of hospitalizations, and sadly then you start to see an increase in the death rate as well. So the earlier we act in these kinds of situations, the better.
But when you look at the moment, thankfully, low death figures in France and even lower here, is it time to reconsider whether the extent of economic shutdown we had earlier in the pandemic was the right decision? Is it time to reconsider that whole issue of herd immunity?
I don't think so, because there's a moral flaw in the herd immunity argument, and it's this. Yes, you can get some population level immunity if 60% of the population catch a virus, but with a mortality rate, even if it's not 1%, because we're better at treating coronavirus now, even if it's 0.5% or less than that, you are paying an appalling price in terms of loss of life. So I just don't think herd immunity is ever a starter when you've got alternatives.
There are clearly massive problems with the testing system, which the Prime Minister said would be world-beating by June. It clearly isn't. Matt Hancock told your committee it would be several weeks before these problems were fixed. What do you make of that?
Well, look, I'm the person who probably gave the government the hardest time of all about the failure to expand testing and roll out test and trace in the early stages. And it's very frustrating that we seem to have hit the capacity limit. But I think it is also fair to say that we have had a big increase in testing capacity over recent months. We're now, I think, testing more than anywhere else in Europe. I am one of those people who think that we should be moving as fast as we can to population-level testing. Population-level testing is something that people like Tony Blair and William Hague have been advocating. I think the government is interested, but I'd like to see us going further and faster, because I think until you have a vaccine, the only way that you can really allow normal life to carry on is for everyone to know that everyone around them has been tested in the last few days.
Just while you're here, I just want to ask you about the other big story of the day, which is Brexit back again. The Northern Ireland Secretary admitted that the bill being published tomorrow, overriding some of the withdrawal agreement, and I quote, does break international law in a very specific and limited way. What do you make of that?
Look, I'm a former Foreign Secretary. I went around the world, and the thing this country is most famous for, above anything else, is that we're a country that respects the rule of law, and we are respected for our respect for the rule of law. So I just don't believe we'll get into a situation where we are breaking international law. All I'd say is this is a very tough negotiation. We're playing tough, but so are the EU.
Jeremy Hunt, thanks very much.
Thanks, Kathy.
Our health editor, Victoria MacDonald, joins us now from the newsroom. Victoria, what more do we know about the problems with testing?
Well, there is a distinct lack of transparency over what exactly the problems are, but I think one thing that has been identified is about staffing issues, and we saw that in the letter for the Prime Minister today to universities saying we need your urgent help. Now, I understand that some staff were seconded to the testing system from universities. They've now gone back to their original research project, so they need more people, but it still doesn't quite explain what the issue is, and it is critical that they get the testing system up and running before the winter, because we do have the universities going back and the schools open. And like many parents, I dread that call from the school saying somebody in the class has coughed and now everybody's going to have to go home and self-isolate. There are issues too. There are discussions now around about second waves, and I've spoken to a number of people today who say it's not quite right to describe it as that, as the first wave never stopped. It just went down to lower levels and we didn't see it, and we can now see it going back up, hopefully not as sharply as it did in March. But they are also talking about, of course, looking at the deaths, and we saw 30 deaths recorded in the past 24 hours. Now, we have to realise that there is a time lag to that reporting. Some of those infections will be way, way back. And again, what you have to be concerned about is those infections going up. You will see hospital cases rising, and you will, unfortunately, see some more deaths.
Victoria, thanks very much.